Hello, I'm Dr. David Clark. This patient is being retreated for diastema closure on the mesials of the maxillary central incisors using the Bioclear Diastema Closure Matrix System. A small drop of water or astringent helps to keep the matrices stable during placement on the teeth. The wet tooth surface aids in insertion of the matrix and reduces gingival bleeding, especially if an astringent is used. The Bioclear matrices, because of their unique and patented root adaptation, become very stable without the use of a wedge. And in this case, there was no need to hold the matrices in place while rinsing off the etchant. Notice how the matrix is easy to keep in position, even without a wedge. The matrix is easily teased away from the tooth to allow insertion of etchant and restorative materials. It opens and shuts like a trap door. Once a small hip of flowable composite is placed and cured, I will place a wedge to help create strong separation for the teeth for a tight contact. Once again, I tease the matrix back to finish placing the composites for this two-stepped staged wedging technique, which also utilizes the injection molding technique. I prefer to reach under the matrix to adapt the composite rather than pinching the matrix later during light curing. The major goal of developing the Bioclear Diastema Closure Matrix System was to reduce or eliminate interproximal finishing by creating ideal interproximal shapes. So I am here quickly finishing the facial area, which is much simpler than the old method for anterior composites, which required significant interproximal finishing. Now that we have the dedicated Bioclear Diastema Closure matrices, treatment of difficult midline diastemas can become predictable and enjoyable. They can even rival the aesthetics of porcelain veneers and surpass any other modality to generate a healthy and beautiful papilla.